Sorry. So these are the results, and as I said, reduced FA, and especially in the corpus callosum, there is a converging evidence of those studies. So the current study that I want to show you, first, we try to go over and minimize some error in many studies and research in autism, specifically in imaging, which are stem from the characteristic of autism. Since we're talking about the whole spectrum in different groups, we cannot conclude that the result we obtain from one group can be related to other groups or to the entire spectrum. That's why in our study, we focused on the autism itself. We didn't, other subjects with high function autism or with major comorbidity were excluded from this study. The second thing, as we have seen before, there are converging evidence about accelerated brain growth during the first 2 to 4 years of life. So there is an increase in white matter volume, but what is this changes? Why white matter volume increase? What is the pathophysiological behind it? That's why we focused on these young ages. That's why we focused on the young ages only between 2 to 4 years of age. So we wanted to correlate this abnormal accelerated volume and also to emphasize that if we can see any findings in this early age, which is very important for early diagnosis and early intervention. We also try to measure other various diffusivity indices and not just look about the integrity, but to better understand the abnormality underlying this abnormal integrity and the hypothesis that we will find some correlation, but we don't look for a specific area, but rather want to see if there is a whole network that already abnormal and will correlate with behavior at this young age. So the study was performed, the MR protocol was on a 1.5 Tesla. We had 42 subjects, 19 diagnosed with autism. I won't show you, there were several tests and analyses that we did, and I will show you only one of which because of the short time. And behavioral assessment was include ADI, they were more accepted both in research and clinical setup, the ADI and ADOS, and 8 children out of 12 were reassessed a year later. And as you can see later, all of them within the cutoff point for autism. So when we study diffusion tensor imaging, there are several methods or several approaches to analyze the data. The first approach is that we have specific hypotheses regarding a network, regarding a region, and then we can either manually define the region and study its integrity, or we can use any automatic algorithm that can define our region. And this is tractography algorithm, either probabilistic or streamlined tractography. There's different 2 algorithms that build us the network that we are looking for, we are interested in, and then study its integrity. It requires hypothesis, it requires a prior knowledge. The other approach is that without any prior knowledge, we just look within the whole brain. This is called a voxel-based analysis, and again, there are 2 approaches. One is coming from more the fMRI study, which is the VBM style, that we register all brain according to the gray matter and then start to look where in the brain there is abnormality. And the other method, which is more suitable for studying of white matter, that we register all brain and build a mean white matter skeleton of all the subject. And then again, voxel by voxel analysis, we study where by group levels where we can see differences between 2 groups. And in this study, I present you results using this method, what's called the tract-based spatial statistics, TBSS analysis. And we also have, which I won't show here, results from tractography analysis, which are 2 independent methods, but got a converging results. So the behavioral results, as you can see, all of our children met the cutoff point of autism in both time points. These values are the mean of all items within each, which in the assessment tool, and you can see this in both time, and all of them, again, I repeat, were within the diagnosis of autism. The first result that we got was a behavioral correlation within the splenium. In this image, you can see in red color the area with significant negative correlation between social interaction score and diffusion, in the DR, which is the radial diffusivity, as I indicated before, meaning more process of myelination, or in this case, demyelination or abnormal myelination process. So in these results, when we see that DR is reduced, social interaction score increase, meaning more severe symptom of social interaction. And this area was found in the splenium of the corpus callosum, or the splenium, which is the posterior part of the corpus callosum. So what we know about this area in the brain in general? Correlation between diffusivity value in the splenium was shown to correlate with IQ, with working memory, motor skills, in other pathology, not in autism. And also in adults, there was a study that showed age-related cognitive decline in this area when we correlate this area with diffusivity indices. In high-function subjects with autism, adults with autism, IQ was correlated with reduced FA in this area. So there is evidence both about the function of this area regarding IQ, memory, cognitive task, and also one study that showed it with high-function autism. What's interesting in this is what is the functional rule. The posterior part of the corpus callosum, i.e. the splenium, connect the two cortices, the retrosplenial cortex. And there is a study that showed recently, a tractography study, that showed that in the posterior part, in the splenium, there are fibers that connect two groups of area of Brodmann area. One is area 5, 7, 16, and 19, which are associated visual area, but more interested is that another group of Brodmann area, 29 and 30, are retrosplenial cortex. The retrosplenial cortex is the posterior part of the cingulum, which belongs to the limbic system. And what we see here, that already at young age, it's correlated with social interaction. The other finding, and I repeat that all those findings went through all very restricted statistical analysis in this method, is there was a positive correlation between the communication score and DA. DA is the diffusion along the main axis of the fibers, only in the left anterior thalamic radiation, meaning as long as DA increase, we get a more severe communication performance. And all those results were in line with our previous reports about the differences between subject with autism and typical developing children of the same tendency of changes in diffusivity values. So what is the anterior thalamic radiation? It's fibers that connect the anterior part of the thalamus with the frontal cortex. It belongs more to high cognitive functions, and it was linked, and other studies, not in autism, linked the diagnosis of high genetic risk for psychotic disorder with a reduction in FA and the anterior thalamic radiation. Also, patients with anterior thalamic radiation infarct show symptoms that were similar to those that can be found in autism. This area, this fiber, is less related to autism and has been less studied. So what we did find? We find two results. We find one, abnormal, in general, abnormal white matter integrity that correlated with behavior already at very young age. I repeat, it's 2 to 4 years of life. And the early myelination in the corpus callosum that was correlated with social interaction, and abnormal axonal growth in the anterior thalamic radiation, which was correlated to communication. And if we try to understand better what is these differences, it's different trajectory, it's different pathomechanism of the development, and whether this causes asynchronization later in life between those two areas, this is something we should still study. What's more important and interesting is that the retrosplenial cortex has a dense reciprocal projection with both the anterior thalamic radiation. So this is not just two independent areas within the brain that each one show some abnormality or abnormal integrity in young children with autism, but those two are highly connected within probably the same network. And the anterior thalamic lesions were found to block the normal development of training-induced discriminative neuronal activity in the retrospinal cortex. In addition, an injection of drug that usually produces psychosis in humans to the anterior thalamus produced injury to the retrospinal cortex in rat within weeks. So those two are highly connected. Whether one region is abnormal developed and then it trajects it to the other, or they are both developed abnormally, we cannot say anything, but we are looking at a specific network and not just two locations. Network that is part of the limbic system already at a very young age that is correlating with behavior. I would like to thank all the people who took a major part in this study, Professor Renata Levy, Dr. Dita Tzachor and Dr. Esther Ben-Yitzhak, and Reut, who is the student who did analysis, and for March of Dime for supporting this study. And thank you for your listening.